The menstrual cycle is your body's monthly rhythm. It is guided by hormones that prepare the uterus for a possible pregnancy. We count the cycle from day 1, the first day of bleeding, until the day before the next period begins. During each cycle, two systems change together. The ovaries prepare an egg, and the uterus builds a lining that can support pregnancy. Both systems must work in harmony. The cycle begins with menstruation. This happens when estrogen and progesterone levels fall because pregnancy did not occur. Without these hormones, the uterine lining is no longer maintained, so it breaks down and sheds. After bleeding ends, the uterus does not stay empty. It immediately begins rebuilding the lining in preparation for the next cycle. Now, the follicular phase begins. In the brain, the pituitary gland releases follicle-stimulating hormone, or FSH. FSH signals the ovaries to start growing several follicles. Each follicle contains an immature egg. As the follicles grow, they release estrogen. Estrogen helps rebuild the uterine lining, making it thicker and healthier. Soon, one follicle grows faster than the others. This becomes the dominant follicle and is the most likely to release an egg. Rising estrogen levels reduce FSH signals, causing the smaller follicles to stop growing. When estrogen reaches a high level, it triggers a surge of luteinizing hormone, or LH. This LH surge causes ovulation. Ovulation is the release of the egg from the ovary. After ovulation, the egg enters the fallopian tube and begins moving forward. Ovulation often occurs around the middle of the cycle, but the exact timing can vary each month. If sperm are present in the fallopian tube, fertilization can occur. This creates the earliest stage of an embryo. After releasing the egg, the empty follicle does not disappear. It transforms into a temporary structure called the corpus luteum. The corpus luteum produces progesterone and some estrogen. These hormones stabilize and thicken the uterine lining. This luteal phase helps hold the lining in place in case a fertilized egg arrives. If fertilization occurs, progesterone levels remain high. This supports early pregnancy by preventing the uterine lining from shedding. If fertilization does not occur, the egg breaks down. The corpus luteum begins to shrink about 9 to 11 days after ovulation. Progesterone and estrogen levels fall. When hormone levels drop, the uterus can no longer maintain the thick lining. The body prepares to shed it again. This brings the cycle back to day 1, menstruation. Hormones also cause common symptoms such as cramps, bloating, breast tenderness, acne, and mood changes. Some people experience mild symptoms, while others feel more intense changes. The most important thing is your personal pattern over time. Tracking your cycle, bleeding days, pain levels, and timing can help you understand your body better. Consider medical advice if bleeding is extremely heavy, pain is severe, or your cycle changes suddenly. These signs do not always mean something serious, but they are worth checking. In one simple line, the lining sheds, follicles grow, ovulation releases an egg, and progesterone decides whether the lining stays. Thank you for watching. If you would like a deeper look at menstruation and why period symptoms happen, watch the next video.